I'm Dr. Wayne Terrace, Chief Medical Officer at Care Compass Network, and today the topic is breast cancer awareness, and we'll be speaking with Nicole Ruhana to discuss the importance of good breast health and screenings. So Nicole, if you'd like to speak a little bit about your role and yourself, and then we can get started with the discussion.
Thank you very much, Dr. Terrace. My name is Nicole. I'm a family nurse practitioner and a nurse midwife. I have been actively involved in caring for women for the last 35 years. And a very important part of my role is teaching women about breast health, breast cancer screening, and how to move forward with those important decisions. So thank you for inviting me here.
Absolutely. So, Nicole, I think we'll start with a discussion of this is Breast Cancer Awareness Month. What is that exactly, and what's the importance of that?
Yeah, absolutely. So Breast Cancer Awareness Month is 31 days. We usually pick the month of October, and this is developed by the American Breast Cancer Foundation. And it's really a public health initiative to bring all topics about breast cancer to the forefront so that we can encourage women to know what their normal breast tissue is, when they should get screening, how they should get screening, but really open up to the public about how we can have conversations about how to avoid breast cancer and then detect it early if you happen to have a diagnosis of breast cancer. So it's really just increasing awareness among women and the population about breast cancer.
Absolutely. Super important, obviously. There's been an interesting phenomenon where breast cancer rates have seemed to increase since Breast Cancer Awareness Month started. Can you speculate as to why that might be?
Well, there's probably several different reasons for that. The first one being is doing exactly what the Breast Cancer Foundation would like to do is we're increasing those very important screening tests. So women hear about breast cancer screening, and then it sort of encourages them to make that appointment and get the breast cancer screening done, whether that be clinical breast exam or a mammogram or an ultrasound. So just by virtue of the fact that we are doing more screenings during the month of October, we're picking up earlier breast cancers at a more frequent rate because we're screening women more frequently right now. We also are under the phenomenon of the baby boomers happening right now. So from now on out, every day somebody will turn age 65 or older for the next 10 years. And those women that are in their mid-60s are really at the prime age for having a breast cancer to develop. So from a public health perspective, we see more frequency of breast cancer in that age group, and there's just more women in that age group right now.
Makes perfect sense. And along those lines, there are certain warning signs or signals that women should be aware of. What are the primary warning signs of breast cancer?
Yeah, certainly. And this is really important why women should really know their own breasts so that they can be aware if there's any changes that could be happening. So, the most basic common ones that we see is a woman who might feel a lump or a thickening or maybe a lymph node under her armpit. That usually brings women in for a breast evaluation with their healthcare provider. Another very important symptom is a change in the breast skin. When we see skin that looks scaly or looks like a rash or could be itchy or is swollen, that's a really important symptom that you need to see your healthcare provider about. It's a very atypical, unusual form of breast cancer called inflammatory breast cancer, but we always are very careful with any skin changes. The change in the size of somebody's breast could also be significant. So if somebody has a breast that suddenly gets larger than the other one, or the breasts develop an unequalness in their size, that's something you want to see your healthcare provider about. And then lastly, any nipple discharge that happens to start. So our big signs and symptoms for that is a clear discharge or a bloody serous discharge. Many times women will leak breast milk. That's called lactation. And that will happen for 1 year after you breastfeed a baby. So it's not at all unusual for a woman to leak breast milk after a year of giving birth. However, we would still want to know that. So anything leaking from the breast is important that you should mention to your healthcare provider. And then if you notice a visual change on your breast, so if you see a dimple on your breast, or if you see that the skin might be pulling a little bit differently, or if all of a sudden your nipple becomes inverted and it's like pulling inward on itself, that's a significant symptom that needs to be checked out by one of your healthcare providers.
Okay, and I think one question a lot of patients would have is, at what age can this happen? At what age can this start? And at what age is breast cancer usually diagnosed?
Yeah, that's a great question. We are seeing earlier diagnosis of breast cancer, and that's partially, again, because of the increased screening. We know that 1 out of 8 women will develop a breast cancer by the age of 60. And we like to say it's related to just family history, but of these 8 women, most of the time there is no predisposing factor. It's just a spontaneous event. The average age of a woman in the United States being diagnosed with breast cancer is age 62. However, half of all women in the United States that are 62 years or older were diagnosed at a younger age. So we really want to keep that in mind. 62 is the average, but it can be much younger. If a woman has a first-degree relative, like a mother, who developed breast cancer, we would start screening that woman earlier, 10 years earlier than what her mother really had developed breast cancer in. So it's really a closer surveillance. 9% of all breast cancers are diagnosed in women as early as age 45. And I have seen some cancers happen down in the 20s and 30s, or the 3rd decade of life. So it's more unusual, but certainly very significant.
So yeah, it's important to be vigilant no matter what one's age is. How do you detect breast cancer?
Well, there's lots of different ways that we can screen for breast cancer, but I want to start out with saying that mammograms are not the only primary mechanism that is a screening factor for breast cancer. So mammograms are great, they are recommended. However, one very important factor is a clinical breast exam by your healthcare provider. So that could be a nurse, it could be a physician, it could be a nurse practitioner. Somebody needs to do a clinical breast exam on your breast every year, along with that mammogram or digital screening. So typically, if a woman is getting annual breast cancer screening every year by a mammogram, we can pick up some very small, irregular areas that might need more views. So it's not at all unusual for the breast care center to call a woman back and say, can you come back? We need to get what's called compression views. So they look at a focal area of that breast a little more closely, and most likely will order an ultrasound. I can tell you that most of the healthcare facilities in this region are using what we call tomosynthesis. So that's just a fancy name for a 3D mammogram. And the beauty of that is it lets us take a closer look at those irregular areas so we can expand them, look at them from different angles, and brighten the image or darken the image so we can really get a much better accurate view with that tomosynthesis. So really it all starts with breast cancer screening, or a woman can recognize a breast lump herself, or when she's having her annual visit with a healthcare provider, the healthcare provider might notice something irregular or a possible breast lump on the breast during that clinical breast exam.
So a question we hear a lot is, well, when should I start getting mammograms, and how often should I be screened? And I know there's perhaps some conflicting or confusing information out there. So maybe you can shed some light on that.
So we really have to take a look at who's recommending what and what practice you follow. But the most important thing when we think about when you should start your mammogram or your breast cancer screening should be a personal decision between you and your healthcare provider. And that's why routine women's health care is critical. You should have that conversation with your healthcare provider because they will do a detailed family history to see if your family history puts you at risk for breast cancer. Does your lifestyle perhaps put you at risk for breast cancer? And then put all those pieces together and take a look at when would be the most appropriate time for you in your tailored situation to start. So the American Cancer Society right now recommends that women start mammograms at the age of 45 and also get a clinical breast exam starting at age 45 if they're routine and healthy and have no predisposing factors. However, most gynecologists and obstetricians would argue that we should start at the age of 40. Now, of course, any of that may change based on your personal history or your family history. But if you're a routine, healthy woman and you don't have any predisposing factors, typically we start screening at the age of 40.
Okay, makes good sense. The question is often asked, well, are there things I can do just in terms of lifestyle? Do things like exercise, healthy diet, reducing stress? Do you think that has any effect on the rate of breast cancer or breast health?
I absolutely do. And there's an ongoing study right now, which is called the Nurses Healthcare Study. And thousands of nurses across the country have been involved in this study where they really look at women's lifestyle, and they've been able to make the correlation in terms of what happens to our lifestyle and how that might increase our risk of breast cancer. So we know that something as simple as 20 minutes of walking a day on a regular basis, at least 5 days a week, helps reduce the risk of breast cancer. Limiting alcohol is very important. The recommendation is less than 2 6-ounces of wine every week. Or limiting that, because we know although red wine is certainly good for our heart, it does increase the risk of breast cancer. So try to limit your alcohol intake and make sure that that's healthy. And then there's an explosion right now happening in terms of diet and cancer. So really the recommendation is 4 to 5 servings of vegetables or fruit every day. And that doesn't have to be a lot. We can be talking about half a cup of carrots would be considered a serving. But 4 to 5 servings of fruits or vegetables a day really supports your immune system and gives you all the nutrients that you need to support that immune system. And then, lastly, no smoking. That seems like a big issue. We know that can be a strong addiction, but we know that women who smoke do have higher risks of breast cancer. So all simple lifestyle changes that you can make to reduce that risk. Stress is also a big one, and we are finding out more about stress and how it affects all areas of our life, not just breast cancer. But this the nurses breast cancer study that I was referring to was one of the first studies that looked at nurses doing different shifts. So, nurses could work days, evenings, or nights, or a combination of any of those. Just by having an irregular sleep schedule affected their immune system enough that they recognized that night nurses were the first ones to have an increased risk of breast cancer through this study. So that's probably related to the stress of forcing our bodies to stay awake during the night, disrupting that circadian rhythm, causing more stress. So we now know that, that stress can really have a strong influence on all factors of our health, not just breast cancer.
Very, very interesting. And finally, let's say breast cancer is diagnosed and now there are various modalities of treatment. Can you elaborate at all on how treatment modalities have progressed over the years or more recently? Have there been changes or improvements?
Sure. I think one of the biggest issues right now is we really push early identification. So we know that if we can identify a breast cancer in the first stage that has not metastasized or gone to any other areas, we've got a 99% that woman will still be alive 5 years later. So that's pretty remarkable. Early identification is certainly the key. I talked a little bit about that tomosynthesis, or that 3D mammogram. The imaging that we can do nowadays is so advanced compared to even what it was 10 years ago. So the images that we get are much more accurate. They reduce a lot of false positives, and we have more advanced procedures. Some women who are at risk for breast cancer can even get an MRI of their breast once a month. It gives us an even closer picture of that breast. So the earlier we can identify, the more likely we are to really be able to treat that. Years ago, we used to automatically do a mastectomy on women, which was life-changing for a lot of women because those cancers were really getting recognized at a much later date. But now that we are able to identify small, localized cancers, we're able to do, in many cases, a lumpectomy, where we can just remove that lump, make sure that we have gotten all the cancer surgically, and then perhaps follow out with a short course of radiation. But typically, the smaller the breast cancer is, the less likely we're going to need longer treatment patterns after that. So really early identification is the key. We're doing a lot with hormonal therapy right now, looking to see if that breast cancer is dependent on estrogen. If it is, we limit the woman's exposure to estrogen medically, so that would reduce the cancer of that growing. And lastly, we're doing a lot of immune exploration on how we can support our immune system to help reduce that cancer from growing. So I certainly think that we're on the horizon of looking at genetic markers and different types of tumor that could be treated in a different way, rather than the standard mastectomy that we used to do years ago on all women, regardless of their type of cancer.
Hey, Nicole, well, thank you so much for all this fantastic up-to-date information. We hope this has been helpful for the audience. And as always, we highly encourage all of you to follow up with your personal healthcare provider to discuss these issues as related to your own situation. So again, we wish everybody a great day. Hope you eat some fruits and veggies and go out for a walk after this presentation. And we'll see you soon. Thank you so much.
Thank you so much, Dr. Terrace. Have a good day.
You too.